Thank you so much for joining us to learn a little bit more about the mental health resources that Phi Gamma Delta provides to undergraduate members, our undergraduate brothers and graduate brothers that are supporting them. For those who I haven't had a chance to meet, I'm Abby McCollum. I'm the Director of Undergraduate Member Experience, which means I manage a few things for the fraternity. Mental health resources is one of them. We sent out an email outlining the Behind Happy Faces resources that we have. This is a partnership the fraternity has had for a couple of years now. There are 9 different sessions that can kind of be used as the chapter needs or sees fit, almost like a buffet of mental health programming and education that they can use. But we knew that we needed a little bit more and some things to complement that, especially for our graduate brothers and our undergraduate brothers who are trying to lead their chapter through some pretty difficult conversations. That led us to a partnership with Archie, who tonight will go over some of those resources that Archie has helped craft specifically for Phi Gamma Delta to help guide you and our undergraduate brothers who are leading us through these conversations, whether it's cabinet members or a mental health or wellness chair that the chapter may have. So without any further ado, I will kick it over to Archie so he can walk you through some of his brilliance and support and resources he's built for us.
Thanks, Abby. Hi, everyone. As she said, my name is Archie. I ask you just to join in accepting my attire tonight. I'm a professional speaker, and this is bonkers travel season for me. I'm home a total of 3, 6, 7 days in October, and this is one of them. So it's late. My husband and my child are in bed, and so this is my authentic self that I'm practicing self-care today by showing up as my authentic self. As Abby mentioned, we partnered together to create a resource. And really, a lot of this conversation came out of conversations I had last year at, I am not a member of your fraternity, so I may get some of the vernacular wrong. Whatever
Academy.
The leadership, thank you, Academy. The Academy happened where I led some mental wellness conversations with the undergrads. And there was lots of requests about what do we do now? How do we support? There were also, kind of as a side note, a lot of chapters creating mental health chairs. Luckily, this is my area of expertise. This is what I do in the field. And so I'd already had conversations with lawyers before I even, not knowing this was going to come up, about what is the best thing to call this thing. And mental health chair is not it. Think about it. Like, we're in a deposition and someone says, oh, you're the mental health chair. What certifications do you have? And they're like, oh, I'm just a college student. So how are you the mental health chair? So talking about it, mental wellness chair or brotherhood chair, or something a little more inclusive, and we'll talk about inclusive language. And you could really see like the wheels turning with the undergrads that I was working with. So I was really excited when Abby and team reached out to give me the opportunity to create this curriculum for your organization. And so I told her I really could have just like screen shared my screen and like pulled up the resource. But I was like, let me put this in a little bit of a different form so that they can come back and they can watch this if they want to. They can watch it with their teams as maybe they're going through the guide. But almost everything of what I'm sharing is in your guide or the new guide. I'm just kind of breaking it down. So let's start, as Julie Andrews so eloquently put, let's start at the very beginning. And let's talk about just overarching themes about college students and mental health. So I do a good bit of media appearances. I'm on different news programs quite a lot. And kind of right as we're kind of rolling out of the pandemic, whatever you define as the pandemic, and whatever you define starting in the ending of that, I was talking about college students and mental health. And oh wait, let me just say this. You're going to hear things like suicide prevention, mental health, mental wellness, feelings. I'm talking about emotions, like all those things are going to come up. Okay. That's probably a given, but I just feel like in any conversation, we just should not just assume that that's a given. So if any of those things you're like, oh, I wouldn't prepare for that tonight. This is being recorded. You can catch it on the replay, but I'm just letting you know, I'm going to say all those things tonight in the event something were to come up for you because of something I said. I also have the chat over here. So it's over here. You can chat me privately or as the group, or you can just start talking. But just know that I might jump because I can't see you. And so when people start talking, it kind of startles me because someone's talking all of a sudden. Yes, thank you. The resource is there. It was in an email, but I know we all read all of our emails, okay? So the resource is there as well. So the woman interviewing me said, well, I was talking about the recent number of deaths by suicide on college campuses. This was right after there was a period in the spring where we lost another D1 athlete every week to death by suicide. And so because unfortunately, that is one of my areas of expertise, suicide prevention. Like sometimes I wish I could be an expert in bubble gum, but that's not what I'm an expert in. So I'm constantly on the news when those things happen. She said, and this is a quote, but isn't college supposed to be the best years of their life? And I was like, I was so taken aback. And I really was like, have you been on a college campus anytime soon? Because like, this is not the best years of their life. Like if this is the best years of their life, that is sad. They're doing everything virtually. They can't go outside their room. They're constantly quarantining. Like this is not the best years of their life. And so I don't really think we hear that phrase as much as we used to, maybe when I was in school in the 90s. That was a pretty common thing that someone said. P.S. I don't really believe that's true, but it was a pretty common thing that people said. So all those students have always had class to juggle, always had like campus jobs or programming or things, like all that stuff has always been there. But now on top of that, we have all this other like all this is just there. Every time we turn around, there's a new thing we need to get a vaccine for. There's just so much that's happening. So like all that existed, now there's but there's also some pretty underlying basic science that I think is important to understand for those of us that work with college students. And so that's sort of what I want to use to kind of set the framework. So on top of all that other stuff, 75% of humans who end up being diagnosed with a mental health problem, that will be diagnosed, it'll onset by the time they're 24. By the time they're 24. So like literally, we are supporting the humans who have all these other things like emotions and hormones are flying, but yet if, statistically speaking, they are going to be diagnosed or have an onset of a mental health problem, it'll happen by the time they're 24. There's been numerous studies that tell us that if a human is going to have a mental illness, it more than likely will occur before the age of 25. And 60% of those of us, I say us because I am one that has a diagnosed mental illness, this occurs in college. Again, so these are the humans that we are supporting on a day-to-day basis. Another kind of interesting point that I didn't know this until I started researching it. Most depression and other forms of mood disorders happen by the time people are 20. So even the humans that are just getting to us, they could be experiencing these things, not know what's going on. We don't talk about those things. In life, we don't talk about Bruno, and we don't talk about things happening in our head. We just don't. Well, that's a problem. And so what we're trying to create in Phi Gamma Delta is a place where humans, one, feel comfortable saying, I need help, and I don't even know what I need, number one. But number next, that we have a trained group of humans supporting them at all levels, whatever level that is, that when folks come forward and say, I need help, and I'm not even sure what I need, that we're equipped to say the appropriate things. Because I was talking to Abby yesterday. Actually, I'm creating a new program called Everything's Going to Be Fine, and Other Lies We Tell Ourselves. Because we just say these things. We just say things to people, sometimes good intentioned, but if I'm on the receiving end in my head, so maybe this will help explain. So my personal diagnosis is major depressive disorder, borderline schizophrenia with an anxiety disorder. So the only difference in my diagnosis and a human that has a diagnosis of schizophrenia is that I've never had a break. When I was sober, I used to be a drug addict. So when I was sober, I've never had a break where I couldn't distinguish between the personalities and the voices in my head. And so with medicine, I'm able to live what we would call a normal, whatever that means, life. Well, all that started when I was going to college. But P.S., I went to a private Southern Baptist institution. I'm very gay. So there was all sorts of like struggling happening anyway. Do you think I was really going to walk up to our campus minister and say, excuse me, I hear voices in my head? Like, that's not a thing that was going to happen in 1994 in Alabama. So we want to create spaces where feelings matter, where what's happening in your head matters, where what we can't see matters. Like, all those things matter. And so this is just another tool in the toolbox to add to what the fraternity already has in regards to supporting people. So that's just a little bit of like foundation of like where we are with college students right now. I will tell you, I've literally been to dozens of campuses this semester, and every single campus, Power 5 schools, private schools, liberal arts schools, it doesn't matter, like regional, it doesn't matter. Every single campus I've been to, there have been men stay around afterwards, either tell me that they realize because of things that I've said, they have a problem with alcohol and drugs, or like something's happening and they're not sure what to do. So this is happening everywhere, and we need to be prepared for it. And when I say prepared for it, prepared how to support those humans. So let's talk about some common verbiage. And I hope this is helpful. Again, you don't have to write down any of this, memorize this. This is all in the guide. So number one, if we talk about, and all this comes from the World Health Organization, this is where all these things come from. If we talk about mental health is a really big term, but it's an overall state of well-being. Like how we cope with stresses, how we cope with work, can we contribute to the community? It's a really, really big term. And so honestly, I don't really use mental health a lot when I'm talking. I use mental wellness. It is a more, because also I'm super glad that during the pandemic, we started hearing more and more talk of mental health on the TV. That's great. But what I heard over and over again is when people were interviewing guests or they were talking about mental health, they were interchanging mental health and mental illness, and those words don't mean the same thing at all. Also, for some humans, especially dudes, mental health, it doesn't have the most positive ring to them. I don't know why, but mental wellness, I've been able to have a lot different conversations, and I think better conversations. So I use mental wellness a lot. I also use mental health challenge more than I use mental disorder or mental illness. So mental disorder or mental illness, those are used interchangeably in the medical community. They're both diagnoses. So you have a mental illness. That is a diagnosis. That isn't something you're like, oh, I have a mental illness today. But this is a diagnosis. Mental health challenge, we all have them. Every single human on this Zoom has had a mental health challenge at some point in your life. We all have. It's just like when you have a physical challenge, like when I sprained my ankle. So let's use these definitions, these categorizations beside here. So there's a major change in a person's physical being. We'll do physical. I sprained my ankle. The change interferes with my ability to live my life. It does. I have to think about where I have to leave earlier. I can't go running, and the change doesn't go away quickly. A sprained ankle does not go away like this. So sometimes I think it's also helpful to, even though there's not always apples to apples, sometimes we're apples to orange. So I can't apple everything, that's what I call it. But when we can with students, people get physical health challenges. People get challenges they can't see. People sometimes don't get mental health challenges or mental illness. A lot of times just because they've never talked to anybody. There's some people that say, you're the first person I've ever heard say that they were schizophrenic. And I'm like, yeah, well, it's just a diagnosis. Like, I can't do anything about it. So whatever. But that's me. That's my choice in life. Most people aren't, or many people aren't as open with their diagnosis as I am. The other thing to keep in mind when we're talking about people is to use person first language. So let's say that I had schizophrenia. I'm not a schizophrenic. I'm a human that has schizophrenia, or I'm a person living with schizophrenia. Same thing. Like I'm not a drug addict. I'm a person that has a substance use disorder. I'm a person that is battling drug addiction. We use it a lot in the recovery community because a person is a person first. They just happen to have a diagnosis. It is not the person. A schizophrenic means that's the entirety of the person. No, they're just a person that has a diagnosis. That's all that is. A person who uses drugs as opposed to a drug addict. So, and this is something I think that especially, you know, I was a chapter volunteer for over a decade before I worked at SIGAP headquarters. Probably should have told you a little bit of that I have a little bit of experience in fraternities. You know, I know that there are members of the chapter that you have more influence with than you don't. I know, like, that's a thing. So sometimes some of these conversations can be had with those humans, and whatever you call your executive board, your undergrad executive council, that as we're talking about things, using person first, learning that at their age will go a long way. So using person first language. I'm going to assume that if y'all have questions, you're just going to type or talk. That's what I'm going to say. I'm just going to keep going. Okay, so I also wanted to give them some do's and don'ts of this volunteer position, because at the end of the day, this is a volunteer position. They don't have any more certification. They don't have any more credentials. So we want to make sure that we're very clear about some things that they should and should not do. And I'm just going to point out a couple of these. I'm not really a slide reader. And again, this is all in the resource. But a couple of things that I think can be helpful. I say this all the time to students. It's one thing for me to stand on a stage as a speaker that your university has brought in to have a conversation about mental wellness and share my mental illness diagnosis. That's one thing. It's a total different thing for people to be inspired by that and then to go back and, as they are comfortable, share with their brothers and sisters. That's a totally different thing. So the more that we can just normalize, I say all the time, the only way we're going to normalize having a mental illness is by making it normal. You know, we make it normal, we just do it. We just make it normal. There's no like 10-step process. It's just like, this is just a thing. But also continuing to have a conversation. You know, I say all the time to chapters, if the one time you talk about mental wellness is like during some month, that's not being committed to mental wellness at all. So how are we going to do this on the regular? And we're going to share with you some ways that we've done that for them. But I also think it's really important to remind them to take care of themselves, because humans that end up in this position specifically are fixers. That's who ends up in this position. They want to fix people. Like that's why they said, I'll do it. And we don't need them to fix them. We need to take care of themselves and then support. So I'm gonna dig into these a little bit more. Also knowing that you can come back and listen to this, or you can honestly even use this section as you're talking to your undergrad. These are things that you should never do. And this is both you as an advisor, a volunteer, and as an undergrad. And let me also say this, like having worked at SIGAP headquarters, even if by profession you are a psychiatrist or a therapist, you really still shouldn't be giving therapeutic advice in this situation. You are connected to this human because you're their chapter volunteer, not their therapist. So that's just for those of us who have been out of school for a while, maybe have a lot more life experience. We also shouldn't be doing this stuff. But on the undergraduate level, absolutely. We should not be giving advice or like, actually, you know, I say all the time when people come and if people give you the gift of saying, I need to get this off my chest, and they say it all, you know what they don't need? They don't need your opinion. Like they just don't. They need you just to listen. So when someone is finished saying whatever the thing they need to say is, to be saying, well, here's what you should do. Now, oftentimes I say, here's what I did. Here's what works for me. But let's get you some help, because what works for me may not work for you. Same thing for the undergraduates. Even if they are studying to be, they want to go into substance abuse counseling, or they want to be a psychiatrist, they're not there yet. So let's say that your chapter actually does have, y'all decide to have a mental wellness chair at the local chapter. They're still not an expert. That's not their job. They're just a resource provider. That's what they're there for. They should be a great listener and a resource provider. And the last one is super important. And this traveled every lane when I was a campus-based professional, when I was a volunteer, when I was a headquarters staff member, when I was at the NIC, and today. I will not do this. I will never agree not to tell anyone. No. And so I teach students and I teach people, if Abby were to come to me and Abby were to say, hey, Archie, I need to talk to you, but before we talk, you have to promise you won't tell anyone. Here's what I say. Abby, listen, I hope you know that I love you. And I hope that because you're coming to me, you know that I'm a person that cares and I want to support and listen, but I cannot make that promise. I would love to keep talking. How can I support you? I'm just really honest. It's really honest. Like, that's not happening. Because what if Abby tells me something that I know that I can't keep that promise? And so then I go tell someone else, well, now I've just violated trust. And if someone is hurting in some way, a violation of trust is not what they need. So really, in any situation, if we're a chapter officer or a chapter volunteer, promising not to tell anyone, just not a good idea. And so that's the answer that I give all the time to students. And sometimes they talk to me and sometimes they don't. And you know what? If they don't, that's their choice. That's their choice. They get to make a choice based upon the boundaries that I have set for myself. These are the boundaries that Archie has created in order to be a support person in your life. If you can't meet those boundaries, that's not my choice. What you decide, what decisions you decide to make after that, that's nothing to do with me. And that's easier said than done. I mean, I have to really work at that, but that is the boundary I've set. And that is the boundary that I encourage you to set, and also the humans in your chapter that you're supporting. Just going to pause for 2 seconds, see if there's anything. Continue. Okay. So signs and symptoms. Okay, so these words are also used synonymously. They don't mean the same thing. So a sign is, let's talk about this in the world of like a health issue. Okay, so a sign is something that can be observed. I can see them. Your physicians can see them. People can identify them, but only those who have professional training should be diagnosing them. Now, a sign can indicate a symptom, but the two things are very different. So if I'm rubbing my forehead, or if, like, you know, if I'm doing this could be a sign that I'm experiencing symptoms of a headache, but the two things are still different. A symptom, the reason why when you go to the doctor, when you're to physicians, have they ever said to you, what signs are you experiencing? No, they say, what symptoms are you experiencing? A symptom is a personal experience of a potential health issue or mental health issue that you can't observe. I experience the symptoms. They're me. You're the only person that can see or describe them. That's why your physician said, what are your symptoms? So a sign is a health issue that can be observed. A symptom is something that I am observing, or I am feeling, and then I can explain it to you. So again, these are lots of words on the screen. This is not usually how I roll in my PowerPoint design, but for sake of time, and also knowing these are all lifted directly from the guide, these are some general signs and symptoms of mental illness. Again, I'm not going to read all these to you. The important thing to know or to note is that there is not one size fits all. You know, they often say that the fatal flaw of alcoholism is it manifests the same way in every single one of us. That is not the case with mental illness. There can be different things that pop up, different signs, different symptoms people are feeling. I would assume someone who does not have my same diagnosis would not have the same thing happening in their head. I would assume, but I've not really experienced that. But there's lots of things that we can look for to be able to say, you know, is everything okay? Can I support you? I'm going to point out just one thing on this one because I think it's important. Is number 4. This happens a lot with those of us who identify as men. And I would say the thing to keep in mind, there's a saying in the recovery community, if it's hysterical, it's historical. If it's hysterical, it's historical, which means, so Abby and I could be having a conversation. She could be asking me something very benign, and I literally lose my ever flipping mind. That has nothing to do with what Abby asked me. Like, there's something behind that. There's something going on. That's the same thing. So mental illness and alcohol and drugs use sometimes go hand in hand. I know they did for me. And we talk about that in the guide as well. But if someone is like pouring alcohol on top of feelings, in that moment, they may feel okay. But what ends up happening, and I can say this from lived experience, my lived experience is, again, this is mine, this is not everyone's. that when you start crashing, the feelings of loneliness and regret and hopelessness get even bigger. And as a man, I tended to act that in anger. Like I would be angry on you. I would react on you. And so sometimes I think we can see those things. And I get asked a lot if I think that fraternities produce alcoholics. I actually get asked that question a lot. And I don't think the answer is yes. And also, I believe that fraternities are a great place for alcoholics to hide. I do, because everyone is drinking. So like I can drink like an unlimited amount of alcohol and it'd be normal. So sometimes there's also, this is kind of a dovetail, but there's also a new study of human genetics. 1 in 13 are predisposed to having what's called a substance use disorder. So in the medical community, we don't really say alcoholic or addict, it's a substance use disorder. And so when I talk to men, and I'm specifically having a conversation about alcohol and drugs, I say 1 in 13. If you have a numerical class of 30, that's 3 people that could be predisposed to have a substance use disorder. We just make excuses for people. We're just like, oh, it's just a phase. What if it's not? What if it's not just a phase? And we're just like making excuses. So
Archie.
Oh my gosh, you did come on camera, but I wasn't expecting it. Go.
Sorry, it's okay. Longtime listener, first time caller. And I have 3 people from my chapter here, so one of them may know exactly the situation I'm talking about here.
Okay.
So how can we, and this is kind of tangential, but to number 4, how can we best support our students whenever there is somebody who has a very clear substance abuse disorder, anger issue? They've made the college aware of it. The brothers are aware of it, have tried to get that person help, and they do not want to engage. And I mean, I know I can tell them, like, we can lead a horse to water. You can't make him drink, all those things. But like, how do I support them to not make them feel like if we can't help brother A, it's all futile?
Yeah. Since we're being hypothetically, does this person live in the facility? Is there a facility?
No, and hypothetically, this person graduated, so it's not an issue anymore.
Oh, okay.
Yeah, but no, so like we didn't have a chapter house
on
campus. They made the counseling center aware of it. There were like, conduct hearings. I mean, it was like every single person on the campus that could have been aware was aware. But also, and then there was the issue of like his father had gone there and had similar issues. And when you meet them, you're like, oh, I definitely see the intergenerational trauma working out here. But so knowing that person didn't want help and wasn't going to seek it out, how do we make the rest of the brothers not lose hope that like we couldn't save him? So like, I mean, I could get into some philosophical discussions with them, but like, what's the best way we can do that overall?
Yeah. So I think there's 2 pieces to this answer. And one you didn't actually ask, but I'm going to answer it in case other people are experiencing the same thing. So for some reason, let's say someone punched a hole in the wall. We have no problem holding that person accountable. We're like, you punched a hole in the wall. You're gonna pay for this. Like, pay for it. However, when it's sprinkled with alcoholic tendencies, when it's sprinkled with maybe doing some drugs, when it's sprinkled with, well, maybe they're struggling with a mental illness, we're like, we can't. Well, actually, you can. That's called accountability. And if you're not holding someone accountable, that's called enabling. There's like an actual word for it. So like it's actually defined. So on the one hand, and we're going to talk about this when we talk about a little later about communicating with an addict. And so I'll just kind of say it now. So I don't believe in tough love. I believe in loving tough. I believe we start with love. That's where we start. And this is not when someone's high. This is not, this is, they have their faculties back together. To say, I'll just keep using Abby. Abby, I love you. I will always love you. You also joined an organization with values and policies. And so moving forward, if those policies are violated, we are going to hold you accountable because I love you. I'm not going to stop loving you. But like, this is going to happen. And that doesn't need to happen on the 12th time, like second, maybe third, because it's just enabling. And so let's play this out. So I don't say anything to Abby. It's a face. And then Abby goes and either makes some choice for herself or has an accident. And so then someone else's life is a choice because of this thing. Like those things really happen. And so we need to explain it just like that to our undergraduates. Would you hold somebody accountable for putting a hole in the wall? Yes, you would. Why aren't you holding someone accountable for following these policies? It's the same thing. So number one, accountability matters. Number next. Yeah, I think it's really, really super important to have people understand that like we can have all the medical stuff. We can know 1 in 13. We can know all of this stuff. At the end of the day, Archie's got to take a step. It took me a decade to figure it out. A decade, like 2 rehabs, like a long time. And I still haven't got it figured out. I just for today, I'm not putting a needle in my arm. So sometimes it's like helpful to like use other people, like literally use other examples. Just because he hasn't figured it out right now doesn't mean that's not going to happen. Do you know how many like Instagram messages I get from students after I've spoken to them years, and they're like, okay, that makes sense. And now I need help. Like the seed of love has been planted. And that's the most important thing, because I know, please don't tweet this out or share this on social media, but like, I didn't really have that relationship and don't have that relationship with my father. There was no really sort of like love happening from that thing for me. So like the fraternity filled that void for me. The fraternity filled the void of volunteers who loved me just for being me, and they were still in my life today. So that seed of love has been planted, and it might grow or it might not, but that doesn't mean that we stop. We're like, oh, well, that was a waste of time. No, a lot good happened. And so let's support the next people. And now we even have more tools to support them with. So those are the things that I would do. Okay. Okay. These are just some more signs and symptoms. So again, number 9. Okay, listen, y'all. I also did not take a shower a day or 2 in college. I have taken a shower today, but if I had not had this thing tonight, I wouldn't have. So sometimes you just don't take showers for a few days. That's okay. But when our clothes are like walking with us, then we can stop up. We can have a conversation. Like, what's happening? And so sometimes those things are okay to talk about. Now, here's kind of the good news is that at the federal level, all the drugs they're using are not legal. It is becoming increasingly, I don't even attempt to have the marijuana conversation. Like I really, really don't, because it's becoming increasingly hard. Used to, I could just say they're all legal. They're not, that's not a thing at the state level. But again, if we're somebody's fraternity brother, then we should be able to have an actual conversation about, we're really smoking weed a lot these days, aren't we? Yeah. Why? Because at some point, I'll tell you from personal experience, drugs stop being fun. They become a necessity. And so when it crosses that line, and they know, then we need to have a conversation. I'm not going to spend a lot of time on this because this is not suicide prevention conversation, although I think those things are very important. And I tell chapter leaders all the time, if you want to be on exec or whatever you call it in your fraternity, and they have a suicide prevention opportunity at your campus, take it. We literally lost another fraternity man to death by suicide last week. He went to his fraternity party, went back to the house and hung himself. And he's like surrounded by people who love him. But we just have to do things differently. When I speak, I always talk about suicide prevention. And I ask this question every single time I speak, and I get the same answer every single time. I say, if you're having a conversation with someone and your spidey senses start going off and you believe this human may be considering suicide, why would you never say, hey, you're not considering harming yourself, are you? It's a bit of a leading question, but I get the same answer every single time. Someone very proudly raises their hand and says, because you don't want to plant a thought in their head. Like that's how pervasive that myth is. That's a lie. That's not a real thing. That's a lie. P.S. Let me just bust that myth for you. I can't plant a thought of suicide in your head. You know why? Because when you were born, what'd you come out doing? Screaming. You came out screaming. Why? To breathe. Like our most basic instinct is self-preservation. So for me to say to you, hey, you're not considering harming yourself, are you? Has nothing to do with planting a thought in your head. It's a BS question. That's what it is. Because if I truly think that you may be considering taking your own life, and I love you, and I roll up with, hey, you're not considering harming yourself, are you? The research is very clear. That person is going to say no. You know why? Because I didn't come correct. I came with some BS. Are you going to harm yourself? No, you name the act. Are you considering killing yourself? You name the act. And 100% of the time, people don't know that. So that's just a tidbit. If there's an opportunity for your humans to get trained in suicide prevention, the answer is yes. We need many of us out there on the front lines knowing what to do in that situation, because right now people just don't. They roll up with, you're not considering harming yourself, are you? Because that's comfortable for me. I don't care about your comfort level right now. I'm trying to save somebody's life. So the more we can do that, the better. So these are all in your guide. There's some more things in there as well about these, but just kind of basic things to be looking for. All right, let's talk about do's and don'ts of support. And again, this is at all levels. Number one, listen with an open mind. Listen with an open mind. I love this quote. This is not my quote, so I'm just going to read it. I love it. Generally, individuals who have a psychiatric illness are not searching for a person who feels as they do. They are searching for someone who is trying to understand what they feel. They are searching for someone who is trying to understand what they feel. That's what we're looking for. And like we talk a lot about like active listening. Listen with care. Listen with care. That's what I need you to do. Even if you don't get it, like you don't understand it, open mind. We sort of are led with this. Please don't say things like this. It'll all be fine. It'll all work out. Or just walk it off. That can be seen as so just diminish how I feel like that. It'll be fine. Well, you can't promise that. So number one, let's don't say things we can't promise. But number two, again, a person is seeking someone who wants to understand how they feel. So when we say things like this, it makes me not think that I can actually share my actual feelings with you, not some sugar-coated version that you need to feel comfortable. Like I need to share what's going on. If you're my person, I need to share what's going on so that number one, I can get it out. But number two, we can find a solution to it. Please encourage them to find help. Please. And also encourage them to go with them. Go with them. Just like if I fell down and sprained my ankle, my fraternity brother might go with me to the health center. Same thing. If I'm hurting here, I don't know what I need. Why can't my fraternity brother go with me? When we have new members, we cart them all over campus. Here's this building. Here's that building. Here's this. Why don't we take them right by the Health and Wellness Center and say, this is where you go. If there's a mental wellness thing you might want to talk about, if you want to talk about something, this is where you go. Because an undergraduate doing that has got way more power than volunteers or me doing it. So encourage them to seek help. Also show them where the help can be sought and go with them. Oh my gosh. This one in life. We say like, we either say, I can't imagine what you're going through. But let's pause and unpack that. Let's unpack that. I can't physically get my brain wrapped around the pain you're feeling. Like it must be so bad. Okay, don't say that. But also like, I understand. No, you don't. No, you don't. Unless you do. But then you only understand your path. So I can't say that I understand what every drug addict, like a person struggling with, I can't say that. I know what my path is like. Empathy, this is not a time for fake empathy. It actually makes it worse. So don't say you understand if you don't. And then I added this one for volunteers. And this actually dovetails into the question that Matt had. Don't take it personally. Don't take it personally. I can give you all the love and support and tools, and you got to choose to use them. And the decisions you make after that or on you. I had a IFC president that I worked with their campus for a while, and he called, and one of his chapter brothers took his life. He died by suicide, and he was taking it very personally. He had done all the things. What else could I have done? You got to stop asking that question. Like, don't take it personally when they don't seek help, when they don't listen to you, when they lash out, when they're like, well, I'm going to drop out. Like, you're doing all the things you can do. That human is making the choice. You don't know what seeds are going to grow over time, but don't take it personally. My last 2 points for you, and then I'm happy to answer questions. So here's the good news. The good news. It's not easy to communicate with an addict. That's the good news, okay? But people who have done it often have found some things to remember and to lead with. So they've given us a roadmap. So that's the good news, is that there is a roadmap. Also, I want to say it is even more difficult to have conversations, needed conversations, with someone who's struggling with alcohol or drugs if you've been enabling them. So in our example before, if instead of having an accountability conversation on week 3, we have it on week 12, it's even tougher, because you've been giving in, you've been feeding. So these are some sort of simple things to keep in mind. Some of these we've already talked about. So I believe that having a substance use disorder is a disease. So this is what's called the disease model. Remember, you're talking to a person with a disease. Be kind to the person. Be kind to the person. You can be really angry at all this stuff, but be kind to the human. That doesn't mean we don't hold them accountable. Be kind to the person. Listen a lot. I believe that in these organizations, we do love each other. So if that is true for you, if you do love this person unconditionally, let them know that. We've already talked about the next one. They have to do it their way. There is no one path for any of these things. And that is the most, having talked to those in my life who loved me through this, that's the hardest part, is watching me continually like fall down and like again, and then figure it again. And then also, again, if you're a human that's listening and you know this, so this is maybe for the normies, we know we never give it like, here's what you should do to get sober. No. Because I don't know where you are on your journey. And so you see me as this guy who's made it. And then you go try the thing. Archie said, do 1, 2, 3. Well, I did it and I can't stay sober, so I'm done. And so then that person makes a permanent decision about a temporary problem. No, we don't give life advice. We don't hand this stuff out. We say, here's what works for me. Let's give you some help. Okay, so those are sort of the pieces that are found within the skeleton of what's there. There are also these things called mental wellness sound bites. And so these are things, I'm not going to talk through this, I'm just showing you. These are things that your chapter can use. So number one, if your chapter does use PowerPoint, they can use these. If not, then your students can use these as a guide, because in the note section, I tell them exactly what to say. Like, would you agree with this? Here's the answer. How would you define? Here's the answer. So there's one about verbiage. There's one about beginning a conversation might be hurting. There's one about 5 tips to relieve stress during exams. Again, we're giving them things. And again, in the notes section, I built this out for them so that we're not just telling people, hey, go support your chapter. We're saying, go support your chapter. And here's some things you can do these once a month to make sure we're having conversations about mental wellness. There's a guide for them. What is self-care? How can men practice self-care? Again, all built out in the notes. And then warning signs of an emotional struggle and what that looks like. And then for summertime, things they can do to improve their mental well-being over the summer. So these will be available to them. And then I've also made a video to not for the chapter, but I made a video for the human. So if the human wants to do this one, they can pull it up. They can read it. If they want to watch the video of me coaching them on how to have the conversation, they can have that as well. Or they can be very smart and just go and do it. So those there's one for each month that they can lead for the chapter. Again, giving them some pretty definitive resources that they can actually take and not just be the guy with his door open all the time, but how can I effectively support my chapter's mental wellness? So that is everything from me Are there questions or things that you want me to answer differently, or whatnot?
The context I'll add as you guys think about questions, and you can drop them in the chat, or turn your camera on, or just come off mute. Those sound bites are going to be really effective whether or not you have a wellness chair, mental health chair. Those are going to be great for anybody who's leading a committee, anybody who is leading a group of chapter members through something. So that could be cabinet, committee members, your new member educator or Foundations of Courage chair. If you are a chapter who is implementing the Built to Lead program and the growth system, if you're an early adoption chapter, know that these programs that Archie just talked about and the Behind Happy Faces are all going to cover parts of those required programming. So also just want to give some of that context and some of that for you all, and just acknowledge that part of these resources are to help our brothers who are leading other people. That doesn't mean you have to do it with the whole chapter. You definitely can, but just to differentiate a little bit there.
Also, just so you have it, I dropped all my information in the chat, my name, my phone number, my cell phone number, my email address, that's my website. So if there are follow-up questions, or if you get into this, I want to be a resource. I'm not on your staff, I don't, but I want to be a resource if something comes up. I'm not a therapist, and I'm not going to guide you through a therapeutic session, but I'll be a resource if there's a question about this or that or whatnot. That's what I'm here for, or want to be here for. And I'll be at well, never mind, I'll say that. Okay. I'll let if there's questions, let me know.
Great.
Okay.
Archie, anything to wrap up?
Just thank you for what you do. Honestly, we couldn't do this thing called fraternity without volunteers. It would cease to exist. And I think it's going to get more challenging to be a volunteer because of the leadership and or lack of leadership skills that some of our young humans are getting. So stay the course, please stay in the trenches. We need you there. But also don't forget to ask for help when you need it, and take care of yourself. Practice self-care.
On the note of asking for help, please use me as a resource. I know that every chapter needs different tools and resources when it comes to mental health. I am not a mental health expert, meaning that's not my educational background, but I am here to help strategize or to help connect you with the right resource. And so please don't hesitate to reach out to me if you're like, this is what my chapter's going through. Abby, help me make a plan. Like, I don't know where to start. If we don't already have the resource, I'll help you build or find something locally on a campus or local community. If we do, then I'll connect you with that. And if we need to adapt it or adjust it, that's what I'm here for. That's what my role is with the fraternity. So please don't hesitate to reach out. I want to echo Archie's thanks. I know that many of you have families, jobs, many other things in your world. So we appreciate your time more than you know. And we also know that the impact you're making on the fraternity is great. Whether it is hearing from undergraduate brothers your names and stories of how you've impacted them, or just seeing the good work your chapters are doing, all of that ties to your positive impact. So thank you all so much. I will hang on just in case people have questions. But with that, thanks for hanging out and have a good evening.